If you've researched antiviral herbs that help to combat the common cold or the flu, you've probably come across Echinacea. It's a powerful plant that's currently booming in the natural health market. Echinacea benefits our health and our well-being like few plants on the planet. Once known as an alternative way to prevent the common cold, now Echinacea is quickly becoming known for multiple uses and benefits, from combating cancer to alleviating pain. Echinacea is a native North American coneflower that was discovered and used as a traditional herbal remedy for more than 400 years by the Great Plains Indian tribe. Technically, it's classified as a herb. Several species of the Echinacea plant are used to make medicine, from its flowers and leaves to its roots. Prior to 1950 and the introduction of antibiotics, Echinacea held an esteemed medicinal status. As the healthcare industry shifted, antibiotics became the rage, and now the famed herb has lost most of its esteem. It's become a popular plant to grow, also called Echinacea purpurea, commonly known as the pale purple coneflower. A flower that resembles daisies with mounded heads and rose, pink or purple petals. It grows on strong stems far above the foliage. Most people don't realize that the chemicals contained in the roots differ significantly from those in the upper part of the plant. If we analyze the roots of the purple coneflower, we can see that they have high concentrations of volatile oils, while the parts that grow above the soil tend to contain more polysaccharides, and these are known to trigger the immune function. Echinacea extract is essentially a tincture from the upper part of the plant. Many of Echinacea's chemical constituents are in fact a powerful immunity stimulator, and they can provide a significant therapeutic value. A few that you're probably familiar with are essential oils, flavonoids, inulin, polysaccharides, and vitamin C. On top of reports of the plant's highly nutritious extracts, we've learned that the portion of the plant that grows above the ground is the most effective. Interestingly, in Germany, dietary herbs are regulated by the government, and above-ground parts of the Echinacea purpurea species are actually approved as natural remedies for urinary tract infections, upper respiratory tract infections, colds, and slow-healing wounds. Fascinating research about Echinacea's benefits regarding brain cancer has been published by the National Institute of Health. The researchers state that the medicinal value of the phytochemicals contained in Echinacea is clearly evident, and it indicates that these agents, as well as the phytochemicals not yet discovered in other herbs, may be valuable tools to combat tumours. The use of Echinacea as another alternative cancer treatment is now being recommended, literally alongside or indeed in the place of conventional therapy, according to these researchers. In the journal Lancet Infectious Disease, the University of Connecticut performed a meta-analysis study that evaluated the effects of Echinacea using 14 studies. It was determined that Echinacea can reduce the chances of catching a common cold by 58%, and Echinacea reduces the duration of the common cold by almost 1.5 days. Craig Coleman, an assistant professor of pharmacy practice and lead author of the study, added that the take-home message from the study is that Echinacea does indeed have powerful cold prevention and cold treatment benefits. This is exactly why Echinacea products are one of the several effective cold remedies. Dr. Coleman found that the significance of the findings become clear when you consider that Americans suffer from 1 billion colds annually, and they spend $1.5 billion annually for doctor's visits and another $2 billion annually for non-prescription cough and cold treatments. The United States Department of Agriculture Natural Resource Conservation Services report that the immune system seems to be strongly influenced by the level of the Echinacea dose. It appears that 10 milligrams of Echinacea per 1 kg of body weight taken daily over a 10-day period is effective as an immune stimulant. In addition, the medicinal journal Hindawi has published material suggesting that Echinacea stops viral colds. However, the most significant results of Echinacea's benefits were the effects when used on recurring infections. To date, research shows that the plant probably reduces cold symptoms, but it seems that the effects of Echinacea are more powerful once cold symptoms start. Another study, this one published in Virus Research, evaluated the effects of Echinacea against viral and secondary bacterial infections that often follow. Plant extracts were able to fight viral respiratory infections, including the flu, while also reducing inflammation and reducing the risk of developing bacterial complications. Therefore, you can see why Echinacea products are useful for viral illness like the common cold and the flu. Particularly, extracts are a favorite recommendation for integrative physicians, homeopaths, naturopaths, and more for their patients. Echinacea's history began when Echinacea purpurea was used by the Great Plain Indians as a painkiller. It's an especially effective pain reliever for some of the following pain types: pain in the bowel, headaches, herpes pain, gonorrhea pain, measles, snake bites, sore throat, stomach ache, tonsillitis, and toothache. Like many herbs, Echinacea is particularly healing for the stomach and the entire gastrointestinal tract. This is according to medical herbalism. For example, Echinacea has shown to work as a mild laxative that provides constipation relief and works as a calming agent. Drinking the herbal tea is especially effective to help with this. For more chronic conditions, a cup of tea every day can help to loosen the bowels, whereas 2 to 3 cups per day can help with sudden bouts. Arguably, the #1 killer worldwide is inflammation. Various factors, including stress, toxins in our food, and poor sleep, all contribute. Thankfully, as explained by the University of British Columbia, regular Echinacea consumption can effectively reverse and alleviate various types of inflammation. Products containing Echinacea may even help with uveitis or eye inflammation. It's a good idea for people who struggle with chronic inflammatory conditions like rheumatoid arthritis to regularly consume the herbal tea in order to reduce system-wide inflammation. Echinacea benefits the skin as well, including improving skin hydration and reducing wrinkles. Research shows that using skin products containing the plant's extracts may help to boost skin health, plus it showed no side effects like skin irritation. Echinacea angustifolia is the recommended species to help with specific ailments related to ADD and ADHD. Both adults and children suffering from ADD and ADHD have higher than normal chances of experiencing emotional disturbances, especially anxiety, depression, and social phobias. Again, dosage is the key. It's recommended that people only take 20 milligrams at a time and no more. In fact, taking more than 20 milligrams per dose can actually cancel out Echinacea's benefits on relieving anxiety. Because of its immune boosting and anti-inflammatory effects, research indicates that Echinacea may work to improve the following upper respiratory symptoms: acute sinusitis, all flus, asthma, the common cold, croup, diphtheria, inflammation, strep throat, tuberculosis, and whooping cough. In a clinical study of asthma sufferers, Echinacea acted similarly to classic synthetic drugs in treating asthma. Researchers wrote that recent studies have shown that the secretion of asthma-related cytokines in the bronchial epithelial cells can be reversed by Echinacea preparations. In particular, Echinacea showed significant bronchodilatory and anti-inflammatory effects. Study authors concluded that this provides scientific basis for the application of this herb in traditional medicine as a supplementary treatment of allergic disorders of the airways such as asthma. For more severe issues, supplement products are the way to go, as drinking tea, for instance, is just not as concentrated. Echinacea is also a fantastic remedy for a whole slew of infections. One study found that taking echinacea and applying a medicated cream to the skin can lower the rate of recurring vaginal infections by up to 16% compared to simply taking the medicine alone. It's also known to help with bloodstream infections, genital herpes, gum disease, malaria, syphilis, typhoid, urinary tract infections, and vaginal yeast infections. A review of 82 studies published in 2018 in Evidence-Based Complementary and Alternative Medicine concluded that echinacea use at 2.4 grams of extract per day for 4 months may help to keep you from catching a cold, or at least reduce the severity and the duration of symptoms if you do catch one. A meta-analysis of studies published in 2015 in the Journal of the American Medical Association found that echinacea use, if started when the first symptoms appear, may help modestly to reduce the duration and the severity of the common cold. A Cell study published in 2009 showed that various types of flu virus, including potentially lethal bird flu and swine flu, were unable to infect cultured human cells that had been exposed to Echinacea extract. While lab study findings don't always prove true in living humans, these results, combined with the results of human studies, show the benefits of Echinacea when used in humans. It suggests that Echinacea use may be worth trying right away if you've been exposed to someone with flu or it's going around in your area. A study out of Europe published in 2015 indicates that Echinacea was as effective as the prescription medication oseltamivir for lessening the severity and the duration of flu symptoms, as well as preventing adverse effects when started at the first site of infection. It's important to take the echinacea at the first sign of any flu symptom in order for it to be most effective. In addition, other echinacea use supported by research includes helping to combat cancer, boost immunity, alleviate pain, treat constipation, fight inflammation, improve the skin, support mental health, and relieve upper respiratory issues. It's important to know that there may be side effects to taking too much echinacea. In some cases, high dose of the plant extracts can sometimes cause nausea and dizziness, particularly in those who have allergies. Therefore, it's not considered safe to use echinacea for treatment of seasonal allergies. It's been reported that injected echinacea can cause more severe reactions, such as diarrhea, disorientation, dizziness, dry mouth, fever, headache, insomnia, joint and muscle aches, nausea, numbness of the tongue, sore throat, stomach pain, unpleasant taste, and vomiting. Some sources claim that echinacea seems to be most effective when taken as soon as symptoms appear, and taken many times a day for 7 to 10 days. It's also believed that liquid forms of echinacea may prove more effective than capsules, which is due to the absorption rate. There's many traditional echinacea benefits and uses, but the strongest scientific evidence available currently supports echinacea use as a way to help to slow the development and reduce the intensity and duration of upper respiratory viral infections like the common cold and influenza or the flu. Other echinacea uses supported by research include helping to combat cancer, boost immunity, alleviate pain, treat constipation, fight inflammation, improve skin, support mental health, relieve upper respiratory issues, and more.